The last group of drugs I want to talk about are looking at drugs, monoclonal antibodies specifically, that can block T cell activity. And so this is a nice review diagram. I may have seen it last year. I don't remember if this was given to you. But essentially it talks about how T cells become activated and produce kind of this immune response. And so a lot of what we look at in terms of these pro-inflammatory diseases, like Crohn's, RA, rheumatoid arthritis, ulcerative colitis, cancer, autoimmunity, and so on and so forth, is usually the result of a overly stimulated or overly active immune response, and which can come about either from, excessively activated T cells or excessively activated B cells, or both, or even innate immune cells that are overly activated or inappropriately stimulated and turned on. And so, there's multiple pathways here that can be perturbed or inhibited pharmacologically. Okay, and I just kind of want to remind you that, really it's that T helper response that kind of can go into the B cell response, which is going to be responsible for the production of antibodies, and then also a cytotoxic T cell response, which is really kind of given the purpose of kind of eradicating tumor cells, of course, but also infected cells, virally infected cells, and so forth, but also cells that have a hard time differentiating self from non-self. And so this is really a very, very large body of knowledge and literature that is really only kind of just beginning to be inhibited and used pharmacologically. And so the kind of the prototype T cell antagonist, or the prototypical T cell inhibitor, is an anti-CD52 molecule called alemtuzumab. And this monoclonal antibody, and we know it's monoclonal because they all have the same suffix, MAB, MAB, causes profound depletion of T cells from the peripheral circulation. Okay, and what's interesting is that this effect might last up to a year in some patients. Okay, and so where do you see this approved? Well, it's got a lot of different approvals that are constantly changing. This literature is evolving very rapidly, but it's currently approved for B-cell chronic lymphocytic leukemia, or BCLL. It hasn't yet, when I wrote this a few months ago, been approved for organ transplants. That might have even changed since then. But for some of the pro-inflammatory GI conditions, this drug has been used with some degree of success. There's a few clinical trials that look at it in terms of how we can use this drug to treat these patients. And so this is kind of in contrast to the previous groups of drugs, which were the tumor necrosis factor alpha inhibitors. They would theoretically perturb or reduce the T cell response through kind of a roundabout way, looking at TNF alpha. This is kind of a more global T cell response. So this is kind of, this alemtuzumab is more of a non-specific kind of global T cell suppressor. Okay. One could argue, why would you use a T cell suppressor for a B cell lineage type of disease? Well, go back here. What's producing the B cell activity, okay, is actually T cell dependent. Okay, so that's kind of the justification here. Likewise, I can give you examples of B cell targets that are used clinically for non-B cell related diseases. A good example would be people looking at rituximab, which is a CD20 antagonist for solid tumors. And there's a whole body of literature about that that's probably going to confuse you unless you go into hematology. But let's just kind of keep things simple. Basically, what you're doing here is you're really reducing the T cell number, and you're reducing the T cells from the peripheral circulation. It's the peripherally circulating T cells that are really kind of going to the GI system and kind of producing this persistent inflammation. Okay, the side effect profile is pretty wide. This drug in particular is associated with what's called the first dose cytokine release syndrome, which is exactly what it sounds. Upon the first dose, all the cytokines from the current T cells and T cells undergoing various phases of maturation get kind of like hyperstimulated, and you get like a cytokine storm, which is problematic. It would manifest as something like fevers and flu-like symptoms. But there'd be physical changes too, maybe elevations in heart rate and so forth. Adverse effects include neutropenia, anemia, co-infection or infection with CMV, and a whole host of nosocomial type of infections. And so you can see these particular side effects come up with various phases of treatment for various disease states. And of course, along the lines of looking at global T-cell inhibition, we can also look at a new class of drugs. And these are a little bit more focused, I would say, for some of the GI type of inflammatory conditions. Alemtuzumab used to be kind of like a front runner monoclonal antibody for some of these GI diseases, and then it kind of took a back seat when the anti-TNF monoclonal antibodies came out. And so now we've got this kind of new group of drugs that are called they're anti-integrins. And so remember, if you will, integrins are compounds, molecules, biomolecules that are required for leukocyte movement typically from the vasculature through the endothelium into an anatomical compartment. I always remember integrins are integral for movement. These monoclonal antibodies are directed against these integrins. And we'll talk about natalizumab in other disease states, probably in the brain behavior and cognition block. But again, these, it's the same mechanism, different disease indications because different diseases have integrins associated with movement of T cells to their specific anatomic sites. So this is kind of a brief introduction to immunosuppressive agents. I hope we've answered some of your questions, but you probably have more questions than answers right now, which is okay. We're just kind of looking at these drugs in terms of just a nice kind of introduction to the specific diseases that could be affecting Jessica Donner in the first case in February. All right, so if you have any questions, please email me, and we will continue immunosuppressive agents throughout the curriculum, and you'll learn much more about these drugs, probably ever than you ever wanted to know, and you'll be all the better. Okay, thank you.